It is 11 a.m., so we'll go ahead and get started. Welcome everyone to our second installation of our virtual Grand Round series. My name is Anthony Pham. I'm the Director of Professional Education at AseptiScope, which is the sponsor of today's program. We're dedicated to bringing education to healthcare professionals that's important to them and new. We know clinician time is very valuable to you guys, so we're making a primary effort to keeping this under 20 minutes as promised. And we do have a quick poll question for you guys at the end, so please stay until the end so that we can get your feedback on what a good topic for next time would be. I'll go ahead and introduce the topic of today's program. It is a recent publication in the American Journal of Medicine, also known as the Green Journal. And the article is titled, "Our Third-Hand Stethoscope Hygiene in the Era of Alcohol-Resistant Organisms." Our presenters today are Dr. Abhay Dhand. He's a transplant infectious diseases expert and antimicrobial stewardship program director, and he is actually a co-author of the AJM publication of today's topic. We also have Cynthia Cadwell. She's a board-certified nurse practitioner, a clinical nurse specialist, and a certified professional in healthcare quality. With that, I'd like to pass it over to Cindy so that she can go over today's learning objectives.
Thank you very much, Anthony, and thank you for bringing this important matter of stethoscope hygiene to the forefront today. I'm just going to go ahead and review the objectives for today so that we can focus on them at the discussion after Dr. Dhahn's presentation. First, we want to understand and describe the data associated with resistant pathogens found on stethoscopes, despite our current cleaning practices, and identify at least two of the difficulties with current use of alcohol as the cleaning agent that we currently use between patients on our stethoscopes. And lastly, probably most importantly, is understanding why a touch-free aseptic stethoscope diaphragm barrier provides an ideal method for reducing contamination. I think understanding these differences and explaining that will meet our quality standards and help provide us with compatible opportunity for the workflow with our staff. With that, I'd like to go ahead and turn it over to Dr. Dhand.
All right. Good afternoon, everybody. Sorry for the little delay. Thank you for joining us. My name is Abhay Dhand, and I'm one of the infectious disease physicians. And I'm going to talk about this publication that was generated after our meeting at the ID Week last year. So what we see in this picture is a physician, and what the troubling thing that you see is that the physician is well protected with the mask, the hands are very well protected with the gloves, but one thing that is not protected is the stethoscope. And stethoscope is something that we use in the daily care of the patient. And you see the stethoscope that touches the patient, it touches the hospital surfaces, touches the lab coat and all the things. So the probability of the risk of transmission of different organisms that is through the hand is also there with the stethoscope. So what we are worried about in this current healthcare scenario is the stethoscope, where it can be a role for transmission vector of different organisms of interest in the healthcare setting. Next slide, please. So what are the current recommendations for hand hygiene? For hand hygiene, it's pretty clear because there are good recommendations for washing our hands, cleaning our hands in between each patient encounter, and to wear gloves and gowns for if the patients are on certain contact precautions. But the recommendations for stethoscope hygiene are not clear. What CDC recommends is that stethoscope should be cleaned weekly, unless they're visibly soiled. But what are the methods of these weekly cleaning? They remain poorly defined. And what we end up using are all the isopropyl alcohol swabs that are available, that are routinely used by different physicians and healthcare providers to clean the diaphragm of the stethoscope. Next slide, please. So I'm going to talk a little bit about the evidence of what the stethoscope hygiene cleaning practices are. Now, these are the two studies that summarize the current practices in the physicians. And what was seen in these directly observational studies was that stethoscope cleaning between each patient encounter was only less than 4% of the times. So this highlights a current problem that is not really meeting the current CDC guidelines for the stethoscope hygiene. Next slide, please. Now we're going to present the clinical data. That is another unmet need. Now, if you look at all the providers in this community hospital stethoscope and ask about their cleaning practices and what is the contamination rate, this is the data that is there. Even though these providers claim to have 86.5% compliance with the CDC recommended treatment guidance for cleaning their stethoscope, even then, up to 91.4% of the stethoscope, when they're cultured, they show bacterial growth. And not only that, there is no statistical difference between the self-reported cleaning frequency or methods and the presence of bacteria. So the stethoscopes, they remain contaminated. So the next slide, please. The next question is, what happens if the cleaning occurs? Does it even work? So in these two slides, what was shown was cultures were done of the stethoscopes of different things to see how much organisms are present. And then, next slide, please. That's the next one. And then what you want to see is what happens when you clean these stethoscopes. Next one, please. So this is the summary of these two studies. Even if you use commonly used cleaning practices, they can reduce the contamination rate, but they're only partially successful at modifying or eliminating these communities. So they do not take all the bacterial communities and other organisms away even after you clean the stethoscopes. And what happens when you clean the stethoscope? Does the risk go away? The answer is summarized in the next slide, where you see before cleaning, in the same slide, sorry. So what you see is that the stethoscopes, if they go down before cleaning, the culture rates are 90%. Immediately after cleaning, the rate goes down to 28%. But unless you keep up with those cleaning practices, the contamination rate goes back up to 95%. Only after persistent cleaning, the rate goes down to 25%, but it does not become zero. Next slide, please. Now, what happens? The question becomes, do stethoscopes, are they a vector? When you control all the other contact precautions and cleaning and hand hygiene, are stethoscopes the vectors for these organisms? So it was done in this beautiful study in which you took volunteers and mannequins were used to look at the transfer of pathogens from one mannequin to another mannequin. And the surrogate markers looking at the DNA, a virus bacteriophage, non-toxic C. diff spores, and a fluorescent marker were used. And the providers, the 30 volunteers, went from one mannequin to another mannequin. And what you see in this study is that without cleaning, the risk of transmission in blue is extremely high. But even after cleaning, the risk goes down, but it is not negligible. So what this does prove is that stethoscope does become a vector in which it can take certain organisms from one person or a healthcare environment to another patient. Next slide, please. So this brings us to what is the current impact of alcohol cleaning. And the question becomes important because alcohol is the current standard for hand hygiene in our hospitals. Next slide, please. So let's talk about certain organisms of interest and what is the impact of use of alcohol as a hand wash and for hand sanitizing predominantly in our healthcare setting. So what we worry about are two main organisms based on CDC, the gram-positive organisms, that will be methicillin-resistant Staph aureus, and Enterococcus faecium, which is developing vancomycin resistant and is known as VRE. And despite of all the current practices, what we are noticing in our hospital is the vancomycin resistant E. faecium is actually increasing. Is there a role because of tolerance to alcohol, which might be associated with this increase in E. faecium? Next slide, please. So this is done in this study in which you have three sets of isolates, but the isolate of interest, what we're looking at are on your right side from 1997 to 2003 and from 2010 to 2015. And these isolates are interesting because they represent two sets of isolates which were exposed previously to alcohol because of the routine hand hygiene cleaning versus isolates that were not exposed. Now you take these historical isolates and then you expose them for 5 minutes to 23% isopropyl alcohol. And what you see is there is a distinct difference between the log killing of these isolates. And what you see from 1997 to 2003, you see a lot of killing, but that killing decreases tenfold in isolates from 2010 to 2015. This leads us to a probable question where what we're seeing is an increased tolerance to these hospital-based VRE, Enterococcus faecium, which might be developing intolerance to alcohol. That is why they are spreading a little bit higher in the hospitals. Next slide, please. So the next organism of interest is Clostridium difficile, and it is important because we know C. diff spreads in the hospital with spores, and spores themselves have they do not get inactivated by the alcohol. So this is an interesting study in which the investigators wanted to look at how much of the C. diff gets transmitted via the stethoscope. It was done in England, and in which 54 doctors in different wards their stethoscopes were screened over consecutive days, and the culture was done in a specific way to promote the growth of C. diff. Next one, please. And what was shown in this study was up to 5% of the stethoscopes were at risk of taking the C. diff from one patient to another patient. So that risk is substantial. Next slide, please. And why is that important again in C. diff? Because after the C. diff, these C. diffs are exposed to alcohol. Another phenomena that is seen is the risk of sporulation goes up. And we know because C. diff gets spread by the spores, increased amount of spores could equal to increase in the risk of spread within the healthcare setting. Let's talk about another resistant organism, that is an MDR strain of Acinetobacter. What happens when it exposed to low concentrations of commercial alcohol? And again, this is the same phenomena that you see, that somehow when exposed to low amounts of alcohol, the concentration of this MDR strain of Acinetobacter actually goes up. So next slide, please. So what we see is that because of exposure to alcohol, the bacteria are evolving in certain ways. In this slide, there is a clinical data in which some people might say that I think we could just get rid of all these problems just by educating all the providers. So what this slide is going to summarize, it's basically a quasi-experiment study on the stethoscope contamination rates before and after education. The providers were educated how to clean their stethoscope. And then they looked at did they change the practice and did it change the contamination rate of the stethoscopes for these multi-drug resistant organisms? So the results, the first result is actually encouraging, in which after education, the rates of stethoscope cleaning, weekly cleaning go up from 31 to 55%, but the rate was discouraging. But despite of this cleaning, the contamination rates did not really change. And 90% or more than 90% of the stethoscopes remain contaminated. I think this is the last slide, so I just wanted to summarize the important points regarding these organisms and the role of alcohol in promoting the risk of transmission.
Thank you very much for that. I appreciate this. I have a few discussion points that we wanted to go over. And I really appreciate the compelling basis for improving our stethoscope hygiene practice from the inability to completely not be able to completely clean our pathogens from our stethoscope with any confidence whatsoever. How do you see organizations being able to show good improved infection prevention processes?
So I think this is what it highlights, the problems. What are the current standards for stethoscope hygiene? So the first step would be to actually define what the best practices for stethoscope hygiene are. And I think the limitations of this are pretty clear. Alcohol does not work. Alcohol, on the other hand, can actually help create some new issues regarding tolerance and increased sporulation of C. diff. The second thing is, how well can you wash the stethoscope? What are the other things? Can you use a disposable stethoscope? And various other ideas. So what we read are new innovations, and what has been proposed is, just like we use the barrier methods for cleaning for using the gloves for our hands, and the barrier methods of using gown between patient care. Same barrier method for stethoscope is something that could provide that unmet need, in which basically the problems that arise from use of alcohol or non-compliance with cleaning, or not even proper guidance of stethoscope hygiene that need there, can be met, and that can help fit the gap that is there, that is because of the risk of transmission to the stethoscope.
Perfect, and that takes me directly to our next little topic here, using the single patient stethoscope, which I find personally useless, and it's like they could even some of us providers with that earpiece reservoir. Do you think an aseptic stethoscope barrier is the answer?
So yes, I think you bring an excellent point. So these disposable stethoscope come with their own risk, and the risk is multiple fold. One, the quality that is for all of us who have used this disposable stethoscope, the quality that you use for this stethoscope is not very good. So the risk of misdiagnosis is real, and that has been validated in various studies. The same thing is the risk that is there from sharing the stethoscope between the ears, and the studies have shown that the contamination rate for within the stethoscope that get passed between the ears of different providers is also there. So I don't think that's, plus the cost, if you have to look at the cost of the disposable stethoscope, they are used, they're not providing the best quality, they're not necessarily providing the answer to decrease the risk of transmission. So while they may be an answer, but they might be an imperfect answer. So I think this that is where the aseptic stethoscope barriers provide an answer in which they do provide a regular quality that is there, that is missing. And I think providers get to keep their own stethoscope, so the quality is there. Plus you use it, decrease the cost, and you do not you decrease the risk of misdiagnosis for a heart condition and lung conditions as well.
Thank you. And my last discussion point is when we're looking at staff who are very busy with the complicated care processes to save patient lives, what are the, how can we change these to these best practices and that are acceptable to the healthcare team, considering their overwhelming amount of work and challenges?
So I think that is the most important part, is whenever you bring something new or you have new technology, how do you increase the compliance? And I think the answer is to make it easy for the providers. And if you make it part of the daily practice, just you make it easy, the process is easy, just like you take the alcohol to clean your hands and to wear the glove. If the process is built in at the same time, when you are doing healthcare, you're taking care of the patients, you use this aseptic barrier along with the other practices. It is easy to use, you're confident, the patients are happy, the providers are happy, and you actually provide the quality. And eventually, if you can show the results of decreased transmission and missing gaps, I think this is how you can promote. So the goal is to make it easy and to provide really good data to support such practices.
Thank you. That is definitely my experience as well. I will say that, I've never seen something be so obvious and basic as the simple concept of preventing transmission of pathogens. I think we are totally at the right point in time for this to be occurring with stethoscopes. With that, I'm going to go ahead and turn it back over to Anthony Pham, and thank you also, Anthony, for as Director of Professional Education and a sponsor, Stethoscope, the sponsor, AseptiScope. I really appreciate this opportunity.
Thanks, Cindy, and thank you, Abhay, for the wonderful presentation, important information on that article recently published in the American Journal of Medicine. So back to us, we are the sponsor. I'm representing AseptiScope. We're an infection protection startup based out of San Diego, and we're on a mission to automate aseptic technique for innovation in infection prevention on both clinicians and patients. This is our flagship product. It's called the DiskCover system. It's a touch-free aseptic barrier dispensing system. We've demonstrated a lot of clinical efficacy. We have many published papers on this, on our efficacy. So if you'd be interested in learning more information about this, please feel free to contact me after this presentation, and also ask about a free trial offer to introduce into your facility. I do just have a quick poll question as I previewed, so I'm going to put that on the screen now, and you can answer in the next few slides. But we just like your feedback on what you'd be more interested in learning about for future Grand Round sessions. And the article that Dr. Abhay Dhand and Cindy Cadwell went over today is available for open access at the provided link, and I will also share this link within the meeting chat. So thank you everyone for your time today. If you have any questions or suggestions for our virtual Grand Round series or for Stethoscope Hygiene, please feel free to reach out to me. My contact information is on the screen. I'm the Director of Professional Education at AseptiScope. You can either email me or message me on LinkedIn. Thanks so much for joining, everyone. Have a nice weekend and see you next time.